अस्सलाम वालेकुम व्यूअर्स। It's been a long time, बहुत अरसा हो गया कि हमारी मुलाकात नहीं हुई because we have been busy with loads of work in our practice and जैसे कि हम आपको थोड़ी देर में हम दिखाएंगे, we've extended our practice and we've completely renovated at the same time we have been very busy. We've recently welcomed some new staff members in our practice. Doctors हमारे पास आए हैं, we have pharmacist staff, we have some more supportive and administrative staff in our practice as well. आज हम आपको एक brief tour देते हैं अपनी practice का और उसके साथ साथ हम आपसे बात करेंगे थोड़ा सा we'll talk about our health matters and how to look after your skin in current pandemic COVID जिस तरह सबको affect कर रही है throughout the world and it's not letting us go. There's a new variant now which is Delta variant. It's apparently been more infectious than in the past. तो आप सबको request है कि please be a part of the vaccination drive और अपने आप को अपने प्यारों को vaccination ज़रूर लगवाएं and make sure कि everybody around you is vaccinated and please follow the social distancing guidelines and do precautions जिस तरह NCOC और हमारे health advisors advise कर रहे हैं. So moving on from here, we will have a brief tour of our practice today. और उसके बाद inshallah we'll sit down and take some questions from you guys about your skins and at the same time आपसे बात करेंगे कि COVID में कैसे अपने skin का ख्याल रखा जाए. So come around guys, we'll have a look. Obviously this is my new office. We've redecorated our office and we have expanded and we have introduced some new treatment options in our practice as well. Right. So next door we have a hair treatment room which we'll show you in a bit because we have patients in there at the moment. This is our hall area and we have introduced pathology services in our practice. So under one roof we provide you with all lab services here as well. This is our stairway to upstairs and this is our reception. Have a look if we have anything on reception. Right. So this is our reception area. This is our new reception. We've renovated this and we provide free Wi-Fi services and television services to our patients while you are waiting. Consulting room and a green room that we have recently redecorated our practice. हमने एक green room बनाया है जिसमें we've introduced some live plants and this is our other consulting room and treatment room and some procedures that we do here. Right, okay. We'll come later. यहाँ हम बाद में आएंगे तो you guys can go upstairs and right, okay, so this is our new hallway and we have our further treatment setup upstairs. नीचे हमारे पास this first room that we have, that room is for hair treatments. That room is for hair treatments. We do we do that is for hair treatments. हम वहाँ पर अपने stem cell treatments करते हैं, hair transplants करते हैं, hair PRPs करते हैं. Alexa, turn on reception. This is our old reception जहाँ हम this is our waiting area for upstairs. This wall looks a little more cozy than a clinical practice. Right. यहाँ हमारे consulting rooms हैं and these are our laser treatment rooms. So we have hair lasers here, some pigment lasers here in this room, and यहाँ हमारे पास we offer hydrofacial therapies and hydrofacial therapy, fat burning therapy, fat treatments हैं हमारे पास, and we do high intensity focused ultrasound. We do offer state of the art photodynamic therapy as well. हम phototherapy भी करते हैं, हम fats को freeze करते हैं, laser करते हैं. As another treatment that we do have the oxygen facial therapy here as well. This is a lovely corridor that we have, और यहाँ we do ये हमारा CO2 laser है, हमारा excimer है, UVA UVB excimer that we treat vitiligo, dermatitis, और ये हमारा थोड़ा diagnostic equipment है यहाँ पर. We also do ablative procedures, and these are our erbium YAG and YAG machines, जिनसे हम pigment को treat करते हैं, skin resurfacing करते हैं. This is a brief review of our practice up here. We'll go back downstairs and we'll take some questions if you guys have any. Right. Okay. Hair treatments in these rooms, and we do PRPs, we do cocktail infusion, skin lightening therapy, and that kind of stuff. That's all done here in this room. And we'll go next door to our office. Questions लेंगे. अगर आपके पास कोई questions हैं तो please file them away and we'll try to answer them. Right.
We have question on Instagram.
I can't see Instagram here at the moment. I can't get my screen to work on Instagram. We'll have a look. Hold on. 1 second. 1 minute. let's have a look. Why am I not on? I can't see this on Instagram. How do I say? Do you guys have access to Instagram? एक मिनट रुकिए, शायद मेरे पास है आपको. Okay. Right. Yeah, I can see Instagram now. So right. So where is the question? I can't see the question. Sorry. Okay. So somebody's asked, okay, is PRP good for hairline? और फिर उन्होंने खुद ही आंसर कर दिया, no, it's not worth it. I don't know what does that mean. Anyways, PRP does help in hairline regeneration depending on your age, your sex, and you know the reason for your hair loss. It's very important. PRP सब लोगों में successful नहीं होती है, so we have to make one of the important point behind PRP is patient selection. हर patient के लिए PRP काम नहीं करती है. बहुत सारे लोग हमारे से कंसल्ट करते हैं, हमारे पास आते हैं, हमें कांटेक्ट करते हैं कि सर हमें PRP करनी है बालों के लिए. But every patient it's not a universal fit for everybody. तो मैं सबको recommend नहीं करता हूँ कि वो PRP करें. कुछ लोग इस तरह होते हैं जिनमें PRP के अच्छे benefits आ सकते हैं, and we do recommend कि आप लोग PRP करें. But again, as I said, कि आप बहुत सारे लोग ऐसे आपने देखे होंगे कि जिन्होंने PRP की होगी लेकिन उनको कोई इफेक्ट नहीं हुआ होगा. The other important thing when you go for PRP is कि आपको kindly ये ज़रूर आप चेक कर लें अपने प्रैक्टिशनर से, जिस किसी के पास भी आप PRP के लिए जा रहे हैं, whether they know how to extract PRP. क्योंकि आजकल बहुत सारे beauty clinics, beauty salons में they are offering PRP, and PRP is offered by non-trained individuals. तो आप प्लीज़ यू मेक श्योर कि आप जिनसे PRP करा रहे हैं they are trained people and they know what they are doing. Otherwise you end up spending money और उससे आपको कोई अच्छा रिजल्ट नहीं मिलता. Right, okay, so we have some other question. The other question is somebody's asked for advice for pigmentation near under eyes. तो एक important fact, being an aesthetic physician, मैं हमेशा लोगों को ये कहता हूँ कि यूजुअली ब्लैक हेड्स जो होते हैं, द रीज़न फॉर नॉट ब्लैक हेड्स, सॉरी, डार्क सर्कल्स, द रीज़न फॉर डार्क सर्कल्स इज कि आपके फेस के ऊपर लाइट रिफ्लेक्शन होती है एक ऑड एंगल से, एंड दैट्स व्हाई पीपल आरंट एबल टू सी द कलर अंडर द आई करेक्टली. So it again depends on person to person. Normally हम creams भी देते हैं, हम PRP भी करते हैं, but in most cases people do need fillers under their eyes, क्योंकि जब filler से हम वो correction कर लेते हैं, वो depression की correction हो जाती है, तो उसके बाद एक बहुत ही extent तक आपकी eye की correction हो जाती है, and dark circles they do get better. किसी ने पूछा है कि can you please tell us good procedure for laugh lines. तो again laugh lines के लिए it's very important कि हम आपको assess करें पहले. You know, one important question and one important point here is मेरे पास बहुत सारे लोग questions करते हैं, हमें बहुत सारे लोग queries भेजते हैं कि सर हमें फ़लाँ ट्रीटमेंट के चार्जेस बता दें, इस ट्रीटमेंट के चार्जेस बता दें. बट रिमेंबर इट्स नॉट वन फिट ऑल. ऐसे हो नहीं सकता है कि एक ही ट्रीटमेंट 10 लोगों को एक तरह ही इफेक्ट करे. तो आप प्लीज़ टाइम निकाल के आया करें हमारे पास. एंड व्हेन यू कम हियर हम आपको एक एस्थेटिक कंसल्टेशन दें, आपके साथ प्लानिंग करें और आपको एक कॉम्प्रिहेंसिव ट्रीटमेंट प्लान दें और उसके अकॉर्डिंगली हम आपको ट्रीट करें. तो यस देयर आर ट्रीटमेंट फॉर लाफ लाइन्स जिसमें ऑब्वियसली टू ग्रेटर एक्सटेंट हम फिलिंग करते हैं. और फिलर्स डिफरेंट टाइप के फिलर्स होते हैं. यू नो देयर आर HA फिलर्स, देयर आर कोलेजन स्टिमुलेंट्स जो हम यूज़ करते हैं एंड दे हैव बेटर इफेक्ट्स ऑन लाफ लाइन्स. एट द सेम टाइम कुछ केसेस में हम PRP और बोटॉक्स भी रेकमेंड करते हैं कुछ लोगों को. Again, Malaika has asked about dark circles. So, Malaika, I've already answered this. आपको chance मिले तो go back and go through my video. Dark circles के लिए obviously we do offer PRP, we do offer creams, कुछ lasers भी हैं, and the most important and the most effective treatment option for dark circles is hyaluronic acid fillers. Right, please explain skin whitening injections and its effects. I see a lot of people, especially young women. मेरे पास बहुत ज़्यादा young ख़वातीन आती हैं and they request for skin lightening. मेरा first answer and my first advice to most of the people who come for skin lightening is that I normally do not recommend skin lightening क्योंकि you know people have very high expectations. लोग बहुत ज़्यादा high expectations होते हैं कि हम skin lightening कर रहे हैं, इससे हम बहुत ज़्यादा गोरे हो जाएंगे. But unfortunately बहुत सारे लोगों में वो effect वैसा नहीं आता है जिनकी जैसे उनकी expectation होती है. तो मेरी हमेशा advice यही होती है कि you know if you want to come for skin lightening therapy, do you keep in mind कि there is a likelihood, there is about 3 to 5% chance कि वो शायद आपके ऊपर काम ना करे. It does work for quite a few people, but कुछ लोग इस तरह होते हैं उनके लिए वो बहुत ज़्यादा effective नहीं होती है. लेकिन in many people it does work very well. आप 2 से 3 tones आपकी skin tone बेहतर हो जाती है. Usually इसके कोई significant side effects नहीं है. It's an antioxidant therapy. लोग अच्छी health के लिए आजकल लोगों को कोविड से परेशानी है और उससे प्रिवेंशन के लिए भी लोग ये थेरेपी ये इंजेक्शंस यूज़ करते हैं. तो देयर आर नो सिग्निफिकेंट साइड इफेक्ट्स. Removal of flat tiny moles on chin and nose will cause 0% scarring. Yes, it's quite likely. अगर flat moles हो तो और अच्छा लेज़र आप यूज़ करें. You know there are different type of lasers. I normally recommend कि आपके moles हो तो do not try not to have them lasered by very high fluence of CO2 laser. आप erbium ऐड करें या flexer करें, they have lesser chances of scarring. Usually थोड़ा सा pigment रह जाता है which gets better after a few months. Again, it's very important that once you have your moles removed, आप topical therapy अपनी continue करें. हम आपको creams देते हैं, हम आपको scar preventing gels देते हैं और हम आपको pigment regulators देते हैं उसके साथ. Assalamu alaikum Diba, I hope you are listening to me and you are doing well. Thank you for your comment. Yusuf, thank you. And so these fillers are for right. Okay, Malaika, fillers are not permanent. They are temporary, they are hyaluronic acid fillers, they are synthetic and closer to your natural body collagen. A good filler will last you around 16 to 18 months. फिर कुछ ऐसे fillers हैं जो long acting हैं, 3 सालों तक भी काम करते हैं, लेकिन on an average a good filler will last you about 16 to 18 months. Mopera has a question she wants to ask. What's treatment for open pores? Open pores, there are multiple treatments depending on how bad and how deep your pores are. We normally recommend people chemical peels. मैं साल में 2 से ज़्यादा chemical peels नहीं recommend करता हूँ. I saw a patient yesterday जिन्होंने 11 chemical peel लिए थे एक साल में, and I was surprised how did that person manage really, because you end up in having significant post-inflammatory hyperpigmentation. आपको छाइयाँ पड़ जाती हैं recurrent peels करने से. So peeling is one option. There are other options like anti-ag, carbon lasers होते हैं, carbon peels होते हैं. उसके अलावा resurfacing lasers हैं, mild resurfacing हम करते हैं, shining peels करते हैं with erbium ag, and we do resurfacing ag lasers as well. Whitening, सपा ने पूछा है whitening injection से कितना color fade होता है? It is very subjective, Sabha. I cannot comment on this. It's a very difficult question. Usually, as a guide, हम कहते हैं 2 से 3 skin tone in people. When it works, it does work, and people do get better about 2 to 3 skin tones. How effective is IV drip is? किस चीज़ की, बिलाल साहब किस चीज़ की IV drip के बारे में आपने पूछा? Can you explain? If you remove mole, what about beard hair? Hair will grow again and the mole stay properly displayed? Yes, your hair will grow back again क्योंकि hair follicle को हम destroy नहीं करते हैं mole के removal के साथ, and the mole gets away. Then you has commented that she has tiny flat moles all over the face. Do you recommend to laser it out or will it get better relief? Then usually जिन लोगों के चेहरे पे moles होते हैं, they normally increase. When you have moles on your face, that means you are prone to getting them even with light sun exposure or light exposure. तो ये आपके usually बढ़ेंगे. तो one of the options is कि जो आपके prominent moles हैं जो आपको अच्छे नहीं लगते वो आप हटा दें, जो आपको अच्छे लगते हैं उनको आप छोड़ दें. Again, there might be some likelihood कि आपको थोड़ी सी recurrence हो कुछ और जगहों पर, but again I strongly advise people कि आप regularly sun creams use करें, because sun creams will prevent mole formation. A good vitamin C serum. There are some good vitamin C serum. Make sure जब आप vitamin C serum लें तो आप कोशिश करें कि वो oil based ना हो. They are water based because water based have better absorption और वो आपको comedogenic नहीं होते हैं, acne cause नहीं करते, discolored नहीं होते हैं. तो there are a few. We will put a comment on here in our notes later on for you. Strawbericious, you asked from which age should you start using hyaluronic acid? There is no age for hyaluronic acid. Hyaluronic acid and Botox आप तब शुरू करते हैं जब उसकी need शुरू हो जाती है आपको. You can start hyaluronic acid in your 20s. You can start them as early as once you start losing your volume, and when you need your volume replaced, you can start having hyaluronic acid. Again with the Botox, if you start developing wrinkles at the age of 20, 21, 22, 23, you should start Botox very early. मेरे पास बहुत सारे लोग आते हैं उनको लगता है शायद Botox 50 साल के लोगों के लिए, but no, that's not the case. Botox आप 20 साल की उम्र से भी शुरू कर सकते हैं. I have patients who have been on Botox now for over 13 years and they don't have a single crease on their face. Do you recommend retinol? Yes, retinol is good stuff, But please be careful, retinol is vitamin A and it is severely exfoliant agent. It causes exfoliation. Do not use it every day. It will cause a lot of exfoliation. It may cause redness, burning, itching on your face, and in some cases may cause rebound pigmentation as well. So be very careful when you use retinol. Perhaps use it once a week or once a fortnight. Okay, we have some questions here on Facebook as well. We are both live at the moment on Instagram and Facebook, so I'm taking some questions from both the platforms. What are the effects of laser hair removal on skin, and kindly tell me song about the eyebrow laser song. I don't know what song about eyebrow laser, but the effects of laser hair removal on skin is कि आप लोग जब hair removal करते हैं आपके बाल चले जाते हैं. That's the effect of hair removal. At the same time, when I do hair removal, मैं हमेशा अपने clients को investigate करता हूँ, क्योंकि one thing is important. मैं हमेशा अपने patients को, अपने clients को कहता हूँ कि hair on women face are abnormal. अगर किसी खातून की चेहरे पे बाल हैं, that means there is some kind of abnormality there. And if there is an abnormality, I always like to investigate it. I always like to find it. So please, आप जब भी मेरे पास आएं, take some time out. Come and see me for your first consultation. मैं एक ही दफ़ा consult करता हूँ, and we normally investigate you. We take your history. We give you a plan for your treatment. बहुत सारे लोग आते हैं, कहते हैं जी हमें डॉक्टर से नहीं मिलना, हमें पता है हमें polycystic ovaries हैं, हमने बालों की लेजर करानी है. But my advice to all of you is कि please have faith in us. If you have given us a chance to treat you for your hair, so give us a chance to investigate you and give us a chance to give you a proper consultation with a proper plan for your hair removal. Rubina has asked that I have taken the dermatitis medication from you, but it has happened again and the medication are very expensive. I cannot buy those shampoos again. So I understand your dermatitis is probably in the scalp. आपके बालों में dermatitis है. So you know, if you feel like those medications were a little expensive for you, आप हमें एक message drop करें, either Facebook के ऊपर या हमारे WhatsApp के ऊपर. हम आपको उसके cheaper alternatives recommend कर देंगे locally जो हमारे पास available होते हैं, and hopefully we can sort that out for you. Okay, sorry, it's not song, it's also that was by mistake. Okay, tell me. Okay, what do you recommend for good hairline? Hamza, hairline मर्दों में usually you lose your hairline because of androgens. Most commonly ज़्यादातर मर्दों में बाल कम होते हैं because of hormones, because of testosterone or androgenic reasons. So one important thing is कि आप ऐसे shampoos use करें जो sulfate free हो, जो बालों को damage ना करें. मैं normally minoxidil recommend नहीं करता हूँ, क्योंकि minoxidil is a very temporary solution to hair restoration. और जैसे आप minoxidil छोड़ देते हैं तो आपके बाल वापस झड़ना शुरू हो जाते हैं. तो there are some other alternatives to minoxidil जो आप use कर सकते हैं, but try and use prescription shampoos ताकि आपके बाल ज़्यादा ख़राब ना हो. अपने बालों की केयर करें, avoid excessive heat, sun and dust. तो जितना आप उसको avoid कर सकते हैं. और एक important और बात ये कि when you are showering, make sure you do not use very hot water, and that can affect your hair as well. और अगर बाल आपके बहुत weak हो गए हैं तो what you can do is कि आप हमें कंसल्ट कर सकते हैं. We can have a look. If you are a candidate for PRP, we will recommend you go for PRP. अगर आप स्टेम सेल ट्रीटमेंट के कैंडिडेट हैं तो हम आपको स्टेम सेल ट्रीटमेंट, स्टेम सेल थेरेपी रेकमेंड करेंगे. Okay. So, do we have any other questions? Okay, there is another question. I don't know. My screen is blocked, so I can't see any new question for some reason. I don't know. ये मेरी screen ऊपर any new comments have stopped. So let me just quickly have a look.
So there's a question from Gulru, 97. She's asking what daily routine one should follow for good skin apart from cleansing.
Right. Okay. A daily routine is very important. देखें यहाँ पर हम एशियन स्किन्स हैं. पाकिस्तान में बहुत सारे मैक्सिमम लोगों की टाइप 3-4 स्किन होती है, and most of us have combination skins. Usually we have, a lot of us have oily skins. एक important factor to keep in mind is a good sun cream. And please remember, जब आप लोग sun cream खरीदें तो do not look at the numbers. Please do not look at the numbers. यहाँ पर लोग कहते हैं जी 100 है हमारे पास, 120 SPF है. The higher the number is, the more comedogenic your sun cream becomes. क्योंकि उसमें physical sun cream add हो जाता है. जब physical sun cream आपके cream में add हो जाता है तो it blocks your pores. You need a lot more cleansing for that kind of sun cream. Normally an SPF for 40 to 50 and even 60 in some cases is enough for our country. Or the other important thing is that when you use a sun cream, you use a sebum control sun cream if you have combination or oily skin. So it's very important that you use a sebum control cream, sun cream, ताकि आपके फेस के ऊपर ज़्यादा ऑयल ना बने. The other important factor is कि when you're using a sun cream, आप घर से निकलने से कम 20 से 30 मिनट पहले वो sun cream अप्लाई करें. That's the first and foremost important factor. इसके अलावा डेली रूटीन में आप कोई स्किन टोनिंग क्रीम ज़रूर यूज़ करा करें. स्किन टोनिंग क्रीम का मतलब मेरा ये है ताकि आप स्किन की पिगमेंटेशन को वो कंट्रोल करेगी. आजकल धूप बहुत ज़्यादा है. Intentionally, unintentionally, we do get exposed to sun in our environment. तो उसको कंट्रोल करने के लिए you should use at least some kind of a skin toner in a day. ये वो वाला टोनर नहीं है जो हम क्लेंजर के साथ यूज़ करते हैं. ये वो वाला टोनर है जो आपकी स्किन को टोन डाउन करता है. If you have dry skin, you should use a good moisturizer in a day. If you have oily skin, then you should use gel-based moisturizer or gel-based medication to tone your skin. Sun cream में एक और important factor ये है कि अगर आप दिन में चेहरा धोते हैं या आपको पसीना बहुत ज़्यादा आता है तो you should reapply your sun cream in the middle of the day at least once or twice. तो till sunset your face should be covered with a good sun cream. Important point in buying a sun cream is that it should have sebum control element in it. शाम में जब आप घर आए तो you should cleanse your face with a good cleanser. किसी अच्छे से face wash से आप face wash करें और उसके बाद दोबारा से आप शाम में कोई भी vitamin C cream या कोई भी आप mild exfoliant agent या mild toning agent वो लगाएं. अगर दिन में आपको लगता है कि सन क्रीम के बाद आपके फेस के ऊपर आप दोबारा कुछ और नहीं लगाना चाहते तो दैट इज़ फाइन. जब आप शाम को आके सन क्रीम अपना हटाएं तो उसके बाद आप टोनर यूज़ करें. The other important thing is before going to bed you should have a good cleansing of your face. आप अच्छे से अगर आप मेकअप यूज़ करते हैं दिन में तो आप प्रॉपरली अपने मेकअप को से लाइक माइसेलर वाटर हो गया या कोई डीप क्लेंसर हो गया उससे अपने फेस को क्लेंस करें. और उसके अलावा आप before night make a habit कि आप hyaluronic acid serum use करें या साथ में आप कोई भी collagen stimulating cream आप before bed use करें. At the same time you can use vitamin C before going to bed. Make sure कि दोबारा आपको मैं बताऊँ कि vitamin C आपको water based हो, oil based vitamin C कोशिश करें ज़्यादा ना use करें. And you can mix these with your night creams and night regimens. At least once a week या once a fortnight आप कोई mild सा home based exfoliant in the form of alpha hydroxy acid या beta hydroxy acid आप फेस के ऊपर यूज़ करें. उसको 20 से 25 मिनट के लिए फेस के ऊपर अप्लाई करें और उसके बाद उसे वॉश कर लें. There are some deep cleanser as well, you know, something like foaming cleanser जो आप चेहरे के ऊपर अप्लाई करते हैं 5-10 मिनट के लिए छोड़ते हैं and they exfoliate your face जो आप हफ्ते में 1 दफ़ा या 2 दफ़ा यूज़ करें before alpha hydroxy acid peels जो AHA BHA peels आप यूज़ करें. I think अगर आप घर में ये simple regimes यूज़ करें जिसमें आप एक night cream, एक sun cream in the day और एक simple exfoliant perhaps you know twice a month ये यूज़ करें, so this is more than enough for a good skin. Right? Is there any other question?
There's a question by Yusuf Zahi Leo Khan. He's saying, sir, recommendation for good sunblock and vitamin C serum. And he's saying, is Sebamed shampoo for hair?
Sebamed shampoo, Sebamed जो है it's a German brand and they have shampoos for different reasons. You know, इनका anti-dandruff shampoo भी है, इनका anti-hair loss shampoo भी है, इनका revitalizing shampoo भी है. There are different shampoos in Sebamed range जो आप अपनी choice के accordingly या अपने cosmetologist और dermatologist के advice पे use कर सकते हैं. आपका दूसरा question था a good sun cream. So there are a lot of brands, you know, they are one of the best brands that I normally recommend, which is a little expensive, is Hyaluronic A, which is again an SC gel. There is another one which is local brand. It's called Sun Pro SC. There are other brands like Seplar SC. They are all SPF 40. Vitamin C may water based. You know, there are 5 to 10% ascorbic acid in Dermafusion skin brightening serums that you can use before bed at night. फिर इसमें 25% भी है और इसके अलावा 15-25% ascorbic acid भी आता है, which a lot of people use. One other thing I normally recommend my clients is जो लोग मेरे पास आते हैं, अगर आपकी स्किन इतनी ख़राब है कि आप एक cosmetologist या dermatologist के पास जाएं, तो please try and follow the advice of your doctor and use prescription strength medication. बहुत सारे जो cosmeceuticals बाजार में मिलते हैं, you know, मेरे पास लोग आते हैं कि हम L'Oreal यूज़ करते हैं, हम Body Shop यूज़ करते हैं. They have very little amount of ascorbic acid or very little amount of retinol. Something जो कोई भी यूज़ कर सकता है, तो उसके आपको बहुत अच्छे इफेक्ट नॉर्मली नहीं आते हैं. And a lot of people use them as, you know, precautious or preventative measurement. अगर आपकी स्किन already damage है और इफेक्ट हुई भी है किसी condition से, तो then you should use higher strength only by recommendation of your dermatologist. Please do not use them without your doctor's recommendation. All good question.
Yeah, can I see more questions?
Okay, there is a question from Hamza about best sulfate-free shampoo. Well, there are quite a few sulfate-free shampoos that we recommend. One of them is hair growth shampoo. This is imported. This is European brand. It's not quite expensive. It's not expensive. इसके अलावा local brands में हैं. There are brands like Nurture. There are brands like Capillum. They are all sulfate-free shampoos. But remember, sulfate is a detergent. Sulfate is the foaming agent of your shampoo or your soap. तो आप जितने भी सल्फेट फ्री शैम्पूज लेंगे वो आपको झाग नहीं बना के देंगे. आपको यही फील होगा कि आई एम यूजिंग समथिंग लेकिन वो it's not making a lot of foam. तो be mindful of this. या आप कहीं ऐसा ना लगे कि हम सल्फेट फ्री शैम्पू यूज़ करें और हमारे बाल साफ ही नहीं हो रहे. Right. Okay. So what else do we have? Is there any other question? No?
No.
Right, okay. So I think that's probably it's been one of the longest discussions we have in COVID. हाँ हमने COVID के ऊपर थोड़ी सी बात करनी थी. Please remember, Delta variant is COVID. Same precaution that applies for any other variant applies for COVID Delta variant. So please do not waste your resources, do not waste your money in investigating yourself whether this is Delta variant or not. Treatment is the same, precautions are the same. Please stay away from each other, please maintain social distancing, please follow SOPs, use mask use करें, ज़्यादा गैदरिंग से दूर भागें. हमारे पास भी जब आए कोशिश करें, प्लीज़ कोशिश करें कि बच्चों को ना लेके आएँ. Come on your own, and when you come, we are very strict about COVID SOPs. हमारी कोशिश ये होती है कि हम जो अपने पेशेंट होते हैं, जो क्लाइंट्स होते हैं, उनको अकेले से ट्रीट करें because we want to prevent any cross contamination, cross infection from client to client. So, and that is the reason we strictly follow appointment based consultation. आप appointment लें, हमारे पास आएं, and please stay away from infection. One important thing that you can do for your loved ones and for yourself is get yourself vaccinated, get your loved ones vaccinated. आपको इंटरनेट के ऊपर, आपको सोशल मीडिया के ऊपर इस वक्त बहुत सारी वीडियोस मिलेंगी जो आपको मिसगाइड करेंगी. There is nothing true about that. मैं खुद भी वैक्सीनेटेड हूँ, मेरी सारी फैमिली वैक्सीनेटेड है. Everybody has been fine. There is nothing like magnetism in these vaccination. And please remember, Americans, Europeans, they have no interest in controlling your brains. They have no interest in controlling your body. उनके अपने काम बहुत ज़्यादा हैं rather than coming के पाकिस्तान के किसी गांव में लोगों को बैठ के उनको वो कंट्रोल करना शुरू कर दें और उनके में माइक्रोचिप्स लगा दें. Please disseminate this information. There is nothing bad with vaccination. This is our only hope. Vaccines जो हमारे पास हैं, they are our only hope. At the moment, the best evidence says that we should get ourselves vaccinated. So please get yourself vaccinated and get yourself prevented from the worst effects of COVID. ये वैक्सीन आपको कोविड से तो नहीं बचाएगी, लेकिन कम से कम आपको सिवेरिटी ऑफ कोविड से ज़रूर बचाएगी. उसके वो नुकसान जो जानलेवा हो सकते हैं उनसे आपको ज़रूर बचाएगी. तो स्टे सेफ, हैप्पी इंडिपेंडेंस डे टू एवरीबडी. खुश रहें, अपना बहुत बहुत ख्याल रखें, और इफ़ यू हैव एनी क्वेश्चन प्लीज़ ड्रॉप अस अ मैसेज. अल्लाह हाफिज़.